So I think first, it's very important to establish trust between the doctor and the patient. But then also, I do teach my patients that I can't achieve all the goals in just one visit, especially initial visit, right? So sometimes patients come in with very long, complicated history, and they expect that, or they hope that I can just fix everything, the rash and the itching and everything else, just from the first visit. But I say that I also need time to learn them, to collect adequate history, to learn what worked and what didn't work before. I always recommend for my patients to keep a diary, a lifelong diary of their symptoms, the treatments, and the response. So I think this partnership in trusting the physician in their care instructions and following them can be very important. And communication.
So she touched on some things that are absolutely essential, like following the doctor's directions. I know some people that have appointments, they cancel all the time, and they're inconsistent with treatments and everything like that. So yeah, it's important for us to do our parts so that we can get the best out of our relationship with our doctor. If the doctor sees something that they can't address, if they refer you to someone, then chances are maybe they have a rapport with that person. So then your team starts to build. I have several doctors, and all of my doctors are in touch. They communicate, and they work together.
I think the key to successful CTCL treatment is collaboration, because it's a rare disease. It's a disease that affects multiple compartments, skin and blood, and then subsequently potentially lymph nodes and internal organs potentially. And so all the compartments have to be addressed. And additionally, the symptoms are not just rash. Actually, the symptoms can be systemic, right? As you, of course, know, the itching, the emotional distress, the potential swelling, fatigue, potential family distress, difficulties with coming to work. So it's a very multidisciplinary disease entity by definition.
So I really think for managing this disease, it takes a village, right? It takes a village of providers, right? Like, you probably have a dermatologist and oncologist, and they're in communication with their dermatopathologist, with their radiation oncologist. It really, truly is not a one-man work. I think that is important to do it in manage this disease in a multidisciplinary fashion.
I have an amazing team, and everyone works together. And you probably can't tell at this point, from the way I look at this moment, but at one time I was in the hospital for 4 months, and all of my skin peeled, and I was down to 150 pounds. And from that whole experience, it's been my same team. This team ended up doing the right things, and I'm here. So my main oncologist is very direct, and that's something that I, as a man, I feel like I respond to a little better. I don't want anyone to beat around the bush. I don't want them to dance around what's going on. I need someone to tell me exactly what's going on and how do we fix it.
I have a lot of patients like Ron, right? They want to know exactly what's going on. And if plan A doesn't work, what is our plan B? What are our plan C? I do have patients that don't want to know, right? Like, just tell me what the next step is exactly, and that's all I want to know. So I think understanding that, different ways works for different teams, and when I say teams, both patients and providers, it is very important to keep a good, healthy relationship and be able to offer the best management for each patient.
It's really comforting when you see someone and they listen. They listen to you. And this is gonna sound stupid, but at one point I said to my oncologist, do you just come here just to see me for my appointment? And he just laughed and said, well, no, but it sounded but that's how I felt. It felt like he was just there for me, focused on me. I just wish that for everyone who's diagnosed with this disease, find someone like that, because these people are amazing.